There are 6.5 billion people in the world, but we all look the same when we lie. Dilated pupils, oblique eyebrows, an upturned lip, the smallest line on your face, the slightest body movement. It all tells a story. It may be human nature to lie, but the truth is written all over your face.
So if you're of the age that permitted you to watch cop procedural dramas in the early 2000s, it's likely you'll have come across this programme. The protagonist is a character played by Tim Roth. He plays a body language expert that can detect a truth or lie without you even having to open your mouth. He claims to do this by observing micro-expressions on a suspect's face. And whilst I'm not here to try and say if there's any truth in this quote-unquote science, I am here to talk to you about the muscles of facial expression, which is what we will cover today. The face is one of the most characteristic and important features of human anatomy. It provides us with the means by which we recognise each other, and its role in direct interpersonal communication is second only to spoken word. We can signal more than 20 different categories of emotion just by selective contraction and relaxation of our facial muscles. Our faces are distinctly different from those even of our nearest living relatives, being relatively small in comparison with the remainder of the skull, and more vertical in profile than those of the other African great apes, tucked well underneath our anterior aspect of the brain, rather than being positioned somewhat anterior to it. Beneath its skin, muscles and other soft tissues, the face has a skeletal core formed by 14 bones. The complex of bones houses part of the digestive, respiratory, visual and olfactory or smell systems. So it's obvious that the face is a complex but vitally important area of the body that is involved in an array of functions that are vital for life. We can't cover everything about it today, and we're not going to even try. But you should have a much better idea of what lies below the surface of your face when we're finished. Of course, we are looking at the anatomy of the face. Here is a picture showing the bones of the face. Although the facial skeleton, or viscerocranium, is made up of 14 bones, we only need to be concerned with 5 of them today. And the good news is that all 5 of these were covered in the session about the skull. They are the mandible, the 2 maxilla, and the 2 zygomatic bones. Make sure you can identify these bones on the picture of the skull. If you can't, you need to revisit the lecture on the surface anatomy and the skull. Soft tissues of the face are arranged in a series of layers that are connected together and to the underlying facial skeleton by a series of bundles of fibrous connective tissue called the retaining ligaments. You don't need to know anything about these ligaments, but as we age, the soft tissues of the face begin to sag. The retaining ligaments cause lines or creases to develop as the soft tissues that aren't directly held in place sag more and more. To illustrate that the soft tissues of the face can be considered as an integrated unit, let's look at an intermediate stage in face transplant surgery. You can see that the soft tissues have been removed as a single piece ready to be transplanted onto the reconstructed facial skeleton of the recipient. The outcome of a surgery like this can be remarkably good, with patients usually gaining movement and sensation in their new face, and often with a very acceptable cosmetic result. The integrated unit of soft tissue has a very complex structure made up of a number of layers. The nature of these layers varies in different parts of the face, but as you can see in this diagram, the skin overlies fatty connective tissue, which in itself overlies a layer consisting of muscle and fibrous connective tissue. The layer containing the muscles and fibrous connective tissue is called the superficial musculo-aponeurotic system, or the SMAS. The exact nature and distribution of the SMAS is still disputed, but the muscles it contains are well known. You can also see the retaining ligaments very nicely in this picture. The muscles of facial expression are a series of interconnected muscles that contribute to the SMAS, and as you will have realised, they are the muscles that allow us to pull many different faces. These two images show the muscles of facial expression. The muscles around the eye and the mouth have been removed in the right-hand picture, so you can see the other muscles a little clearer. In particular, you can now see the muscle of the cheek, the buccinator, which was largely hidden in the left-hand picture. One aspect of these muscles that isn't clear from all of these pictures is how they are merged together. It is often difficult to tell where one ends and the next one starts. This is most dramatic just to the lateral corners of the mouth, which are really called the oral commissures. Just lateral to each commissure, several of the muscles of the face blend together. As you can see here, the arrangement is vaguely reminiscent of the spokes of a wheel, inserting into its hub. These hubs are called modioli, so one is called a modiolus, from the Latin word for wheel hub. They are particularly important in relation to functional movements of the oral sphincter and are clinically important in dentistry and aspects of facial surgery. Before we delve deep into the realms of the face, let's have a look at the learning objectives for today. After this lecture and with any further study, you should be able to complete these learning objectives. To identify the main muscles of facial expression in diagrams and describe the function of each of the main muscles of facial expression. You must also be able to give an account of the motor branches of the facial nerve and outline the role of the trigeminal nerve in providing sensory nerve supply to the skin of the face. I have divided these learning objectives into 3 parts for the purpose of today's video, and the first ones we are going to look at are the muscles of facial expression and their functions. So we've been putting it off, but now it's time to name a few of the muscles of facial expression and think about what they do. We are only going to consider a few of the muscles. Their names may seem complicated in some cases, but they often describe what the muscle does. So when you learn the name, you also learn the function. First up is the orbicularis oris. This muscle encircles the opening of the mouth, or orbiting the oral region if you like, and acts as a sphincter. Then we have muscles that alter the position of the oral commissures by moving the modiolus. These include the depressor anguli oris, the levator anguli oris, and the zygomaticus major. Hopefully, by considering their names or looking at the positions of the diagram, you will realise that the first of these muscles pulls the commissure downwards, whilst the latter two pull it upwards and backwards in the case of the zygomaticus major. Other muscles act to elevate or depress the upper or lower lips respectively. These include the depressor labii inferioris, which depresses the lower lip, the levator labii superioris, which elevates the upper lip, or the zygomaticus minor, which also elevates the upper lip. The mentalis is the sulking muscle. It pushes out your lower lip, upwards and outwards, and it attaches to the skin of your chin, so that when you tense it, you have a dimply orange peel chin. The buccinator is a muscle of the cheek. The buccinator is more substantial than most muscles of facial expression. It runs in the cheek, attaching to the maxilla superiorly and the mandible inferiorly. Here is a clear review of the buccinator with the orbicularis oris and the muscles of facial expression called the risorius. Buccinator is a surprisingly important muscle, playing important roles in suckling and therefore the survival of babies, and in the controlling of the bolus of food during chewing. And whilst we're looking at the buccinator, I want to point out another important structure, the pterygomandibular raphe. This fibrous band of connective tissue defines the posterior boundary of the buccinator. The raphe is used as a landmark in inferior alveolar nerve block procedures, so it has considerable relevance to your future practice. Let's go and have a look at the learning objectives and see what we're going to look at next. So the next thing to look at is the facial nerve. So now you know some of the names and the positions of the muscle of facial expression and have a vague idea of what they do. Of course, they don't do anything unless directed by a motor nerve. The good news is that all the muscles of facial expression receive their motor supply from the branches of the same nerve, the facial nerve. The facial nerve has many functions, not just to innervate the muscles of facial expression. However, the branches that go to the muscles have no other function. They are purely motor. The facial nerve emerges directly from the brain, and branches of it leave the skull via a variety of foramina and gaps between bones, called fissures. As such, it is an example of a cranial nerve. We have 12 such nerves emerging from either side of our brain, numbered 1 to 12. The facial nerve is cranial nerve 7. More nerves, so-called spinal nerves, emerge from the spinal cord. Here we can see the branches of the facial nerve running anteriorly across the face to supply the muscles of facial expression. Remember that these aren't the only branches of the nerve by any means, as we'll see more in anxiety and pain management. These nerves emerge from the skull by travelling through a canal in the petrous part of the temporal bone. Just after emerging from the skull, they pass into the parotid gland, the largest of our salivary glands, which we will cover more in a future video. The parotid gland lies on either side of the face, just anterior to the ear. The facial nerve fibres don't do anything in the parotid gland, they just pass through it. However, if you administer an inferior alveolar nerve block incorrectly, you can deposit anesthetic solution into the gland and thereby temporarily block the motor branches of the facial nerve running through it. This will temporarily paralyse the side of the patient's face, but it won't have anaesthetised the teeth. And this is a picture of somebody with facial hemiparalysis. The branches of the facial nerve innervating the muscles of facial expression are classified into 5 groups depending on the region that they supply. We have the temporal branches, the zygomatic branches, the buccal branches, the mandibular branches, and the cervical branches. This image on the right is a demonstration of how we can remember these branches, with the opposite hand crossing round the back of the head, superimposing the facial nerve branches onto the face of a patient, or ourselves. We have the temporal, the zygomatic, the buccal, the marginal mandibular, and the cervical. So we've covered quite a lot of ground today, so I'm very briefly going to introduce this next structure, the trigeminal nerve. This isn't because it's not important though. The trigeminal nerve is probably the most important anatomical structure you'll study, as it provides the sensory supply to almost everything in the oral cavity, including all the teeth and gingiva. However, this isn't why we're looking at the nerve today. As well as innervating the oral cavity, the trigeminal nerve is the main sensory nerve for the entire face, including all of the skin covering it and most of the cavities within it. Like the facial nerve, the trigeminal is a cranial nerve, so it emerges from the brain, and most of its branches pass through foramina and fissures within the skull. Also, like the facial nerve, the trigeminal nerve has many functions. The trigeminal nerve, and it's important to remember that you have one on each side, has a large swelling just after it leaves the brain. This is the trigeminal ganglion, where all the cell bodies of the sensory nerve fibres travelling in the nerves are found. The trigeminal ganglion gives rise to 3 large nerves. These are called the first, second, and third divisions of the trigeminal nerve. As the trigeminal nerve is the 5th cranial nerve, these are often referred to as V1, V2, and V3, because cranial nerves are generally numbered using Roman numerals. So the trigeminal nerve is cranial nerve 5 or cranial nerve V. The 3 divisions each has a name. The first division is called the ophthalmic nerve, which passes behind the eye. The second is the maxillary nerve, which passes through the maxilla to supply the middle portion of the face. And the third is the mandibular nerve. The divisions and their branches are shown in green for ophthalmic, orange for maxillary, and blue for mandibular. Each division of the trigeminal nerve provides sensory innervation to a particular area of the facial skin, as well as the deeper structures. Here we can see the fields innervated by the 3 divisions. You may wonder why this is relevant, but remember that branches of the trigeminal nerve are targets of dental local anaesthetic procedures. In some cases, you can tell when a nerve has been anaesthetised because a specific region of the facial skin will have become numb. For example, the lower lip becomes numb when you give an inferior alveolar nerve block. So there we are. We've looked at the viscerocranium of the face and the layered structure of the soft tissues, the muscles of facial expression, the facial nerve, and the trigeminal nerve.